Next we have Dr. Sandeep Kumar Sahu. We're talking on periorbital arteriovenous malformation.
Okay, thank you. Good afternoon, you all. This is a case report. Periorbital arteriovenous malformation with a rhinosporosis extending into oropharynx. So this is case of 48-year-old businessman. Chief complaint of painless swelling near right eye, lower lid for past 1 year. Swelling was insidious in onset and gradually progressive and was associated with watering from the right eye. It was painless and was not associated with diminution of vision or any other ocular complaints. On examination, it is a soft, non-tender, non-translucent, hypopigmented mass with dilated blood vessels seen near lower eyelids, which was extending from the medial canthus over the lacrimal area to upper cheek, and no trial pulsation was felt. The size of the lesions did not increase with Valsalva maneuver, and mucoperineal discharge was there, and it is a partial patent with hard stop. And the CT he was carried with shows 32 into 19 into 24 millimeter heterointense lesions with linear serpiginous vascular structure within it, and seen involving the right lower lid, involving likely to be a provisional diagnosis of a low flow venous malformations. So we plan for a excision biopsy, but when it's a incision given, it's a profuse bleeding. So we control the bleeding and plan for and stop the dissections and plan for a evaluation with imaging and any scope for guided use of sclerosing agents. So on CCT showing soft tissue with a bunch of vessels at medial canthus of right orbit. Lesion is extending to along with right nasal cavities and extending up to the uvula. And there is a 3D multiphasic images of CT angiography showing a vascular malformation involving nasal cavity. So there is a sclerosing agent will be washed out if you thought about that, and we sought for a ENT consultation. On endoscopy, it was found to have a mass of rhinosporidosis in interior meatus extending to the nasopharynx and going to the lacrimal duct system. So with a diagnosis of with imaging with AVM and rhinosporidosis ENT endoscopy, we plan for both open and endoscopic excision and biopsy for it. So on histopathology, it have two distinct lesions. One is superficial, one is a deep one. And superficial lesions show a large thick-walled sporangia with endospores in subepithelial and in the epithelial layer. So it's rhinosporidosis, and deep one with dilated congested vascular channels with variable size vessels, which showing a haphazard arrangement of the smooth muscles and suggestive of arteriovenous malformation. This is another view of that, and also endoscoping tissues also show rhinosporidosis and arteriovenous malformation. And so periorbital rhinosporidosis can coexist with arteriovenous malformations, and rare multiphase CT angiograph can help in management before final diagnosis with histopathology. Valsalva test may be masked due to superficial lesion. And concluding with managing orbital AVM with rhinosporidosis poses a significant challenge and require a multidisciplinary approach and careful preoperative planning. And it is paramount to consider unusual differential diagnosis in cases where typical clinical and imaging features are inconsistent, and increase awareness for these unusual presentation can aid in prompt and appropriate treatment, preventing potential complication and improving patient outcome. Thank you for listening. Yes.
Thank you. So was this finally rhinosporidiosis or was this a vascular malformation?
Sir,
so was this rhinosporidiosis or was this a vascular malformation? What was the final diagnosis?
Both are coexist with a deeper lesion is a arteriovenous malformation and rhinosporidosis as a histopathologist.
What is the mechanism according to you?
Mechanism. This is a coexist. It's not any mechanism to have a correlate with rhinosporidosis and arteriovenous malformation, but it's a real condition. It can occur both the lesions in same site.
Right, because your presumptive diagnosis was a low flow malformation.
Initially we diagnose it is a low flow vascular malformation, but during the surgery, the bleeding, so it is actually not a low flow. Low flow means that is capillary, lymphatic, and this venous one, and it's a high flow, means arteriovenous malformation. So during our surgery, so we thought it's something
during a
different,
surgery,
not a low flow
the
one.
nature of bleeding, what is the nature of bleeding?
Nature jet type, when we nick it, the as it is a arterial one, okay, it will not a oozing one, it will a jet type of.
So it is just a vascular lesion.
So it is a arteriovenous malformation. So but it is masked in Valsalva and Bain test. That is another thing. Usually in a vascular means arteriovenous malformations, it will be increased with your Valsalva. Also there may be a proptosis if it is a retrobulbar extension is there. But here in my case, there is it is negative.
Thank you.
Mix of rhinosporoidosis and AVM has been previously reported in literature.
No, it's as I searched in PubMed, there is no such report before. Both coexist.